Amid the rising Omicron threat, Union Health Minister Dr. Mansukh Mandavia will be chairing a crucial meet anytime now. Mandavia will be meeting with state representatives on airport screening and surveillance with the airport public health officials and port health authorities. Now, India is on high alert as 6 international travelers have tested COVID positive amid this Omicron threat. On the first day of operations of the guidelines for international travellers that was issued by the centre, 3,476 passengers from 11 international flights, these are from at-risk countries, were screened on Wednesday. 6 passengers were found to be COVID positive. Samples of all the positive passengers have been sent for genome sequencing to the lab, so we still don't have any confirmation on whether these are Omicron carriers or not. A total of 11 international flights landed at various airports of the country from countries that have been identified as high risk.
If one sees that the first report was from South Africa, the report was on the 9th of November. So during that time, many travels have happened all over the world and from and within South Africa. So one would not be surprised if this variant is detected within India. It's just a matter of time, of course. But it should not necessarily cause a panic because majority of these infections might be asymptomatic or might cause mild diseases.
Now, there's been a bit of confusion also about Maharashtra's travel guidelines because they are different from what's been issued to the rest of the country, from what the centre has issued. India Today spoke exclusively to the Maharashtra Health Minister Rajesh Tope over the guidelines issued by the government at airports in Maharashtra.
Why are you insisting on RT-PCR if I am double vaccinated and I want to come to Mumbai?
Yeah, absolutely. You are right, and we will be reviewing it. We had actually, after issuance of the order, we have deferred it at present, and we will be amending it as we will fall in line with whatever the other states are, or we will fall in line as per the government of India.
You're giving us a very big news point which we should flash. You're saying Maharashtra will defer the rules and you will fall in line with the rest of the country. Am I to understand, therefore, that for now at least you're keeping these guidelines on hold of RT-PCR and institutional quarantine?
No, not all, I mean to say, but the interstate actually is a hardship for everyone to do the RT-PCR test for every citizen flying from Delhi to Mumbai and from Mumbai to Bangalore. Right. So all these passengers will be facing a lot of hardship. So I think that is really a point which needs to be amended. Right. And so I had spoken to the Chief Secretary. Our Honorable CM is in the hospital at present, and so he has also spoken to the Honorable CM. And we are 100% amending that hardship clauses which has been mentioned in the orders issued.
Let's take this across now to Aishwarya Paliwal. She's joining us live from Delhi with the latest updates on how the centre is planning to combat the Omicron threat, of course, in close coordination with the states. Aishwarya, good morning. Everyone's, of course, going to be focusing on the big takeaways from the meeting that Union Health Minister Dr. Mansukh Mandavia is going to have anytime now with state representatives and also authorities from different airports.
Well, this is a very crucial meeting. From what we are understanding, the government is now very closely monitoring the cases that we have.
Apologies, we've lost that connection with Aishwarya. We'll go across to her again to get those details on exactly what the centre and states are doing and how they're working in close tandem to combat the Omicron threat. It's not just India. Countries worldwide are imposing travel curbs to keep the Omicron spread at bay. And here's a report of how different countries have responded to this threat.
Many countries, including the United States, France and Japan, are putting in place tougher border controls and rules for air travelers to guard against the new coronavirus Omicron variant. The US Centers for Disease Control and Prevention says all air travelers entering the country, including American citizens and foreign nationals, will have to show a negative COVID test performed within 1 day of departure. The World Health Organization said at least 56 countries were reportedly implementing travel measures as of November 28th. But the UN Health Agency is warning that, quote, blanket travel bans will not prevent the international spread, and they place a heavy burden on lives and livelihoods. So far, at least 24 countries may have reported cases of the variant, but some of the early indications were most cases were mild, with none severe, according to a WHO official.
Hope for the best, prepare for the worst.
That's what European Commission President Ursula von der Leyen told a news conference.
Vaccinate, boost.
She also emphasized the role of vaccines and urged EU member states to step up inoculation campaigns. Britain and the United States have also expanded their booster programs in response to the new variant. In South Africa, in the region where the variant was first reported a week ago, the National Institute for Communicable Diseases flagged a large number of COVID-19 admissions among infants aged under 2 as an area of concern. But an expert at the institute cautioned against linking that with Omicron just yet.
La décision est donc adoptée.
Meanwhile, the WHO agreed on Wednesday to launch negotiations on an international pact to prevent and control future pandemics. The agreement is hoping to cover issues from data sharing and genome sequencing of emerging viruses to equitable distribution of vaccines and drugs derived from research.
So the debate over booster doses here in India has been reignited with the threat of Omicron in focus. The Serum Institute of India sought approval now for a booster dose for its Covishield vaccine from the Drug Controller General of India. Serum Institute has cited UK's regulatory booster approval for the AstraZeneca vaccine and has claimed that it has enough vaccine stock in the country to go ahead for a booster dose as well. COVID-19 Task Force member N.K. Arora has said that India will have a policy on booster doses in the next 2 weeks. So far, 36 nations across the world are administering booster COVID doses to their population. The United States is leading in that count, having administered 1.24 crore booster doses, followed by Turkey with 1.19 crore booster doses.
If somebody has not been able to mount enough immunity after the 2 doses, for that individual or for a special subgroup, one could think of, administering a 3rd dose. But the discussion around that should be disjointed from the Omicron because we do not know yet whether the presence of Omicron would require a vaccine, because we must remember that these vaccines against COVID-19, they are disease-modifying vaccines. They are not infection-preventing vaccines.
We know that the virus has infected people who have received 2 doses of vaccine. We even know from the Israeli case that there is a person who had received a booster dose of a Pfizer vaccine, therefore 3 doses of vaccine, and still got infected. So we need much more clinical information on the severity of illness, much more clinical information on when it infects a vaccinated person, what it does, how severe is the breakthrough infection, before we decide what else is needed.
Our reading as of now is that the boosters, given the situation of the vaccination program that we have today with our vaccines, is really not required at this point in time. We'll continue to explore the timing and the need for the boosters going along. There are studies that are in the offing. There are studies that are ongoing, in fact, and there is data that's very systematically being tracked.